Hi, welcome to Medical Coding Club. Today I will discuss about surgery section CPT changes 2023. The surgery section of the CPT manual will include updates to several of the subsections starting with integumentary system. So we'll start with integumentary. So we'll see what are the CPT changes in integumentary system. So in this section we'll include 3 new codes, 1 deletion and 1 revision, including updates for removal of sutures or staples and implantation of absorbable mesh or other prostheses for delayed closure defects. So 15778, this code says it's a new code and it says implantation of absorbable mesh or other prostheses for delayed closure of defect, that is external genitalia, perineum and abdominal wall due to soft tissue, infection or trauma. So under integumentary system there are two new add-on codes which allows to capture practice expense when sutures or staples are removed in the office at the time of E&M surveys. So add-on code 15853 says removal of suture or staples not requiring anesthesia. List separately in addition to evolution and management code. And another one is 15854, removal of sutures and staples not requiring anesthesia, separately in addition to E&M code. So here you can see the difference that 15853 says suture or staples and 15854 says suture and staples. And we should assign this code with E&M when patient coming back for removal of suture, and we should see that sutures are removed, the what kind of suture it is that is not requiring anesthesia, then we are going to assign 15853 or 15854 with evolution and management code. So these are the two new add-on code under integumentary system. So one revision and one deletion. We'll see the revision code, that is 15851, that says removal of sutures or staples requiring anesthesia, that is general anesthesia or moderate sedation. And one code will be deleted code, that is 15850, that says removal of sutures under anesthesia by same surgeon. So this 15850 code has been deleted. So you should know this and you should remember this code. So next will be musculoskeletal system and we'll see what are the changes under this section. So there will be one new add-on code, that is 22860 in musculoskeletal system. It describes total disc arthroplasty and discectomy to prepare an interspace. And code 22857 and 27280 have a minor revisions to their long descriptors. That means there are small, the minor changes have been revised. And we'll see the new add-on code 22860 that says total disc arthroplasty, which is artificial disc, anterior approach including discectomy to prepare interspace and second interspace lumbar. List separately in addition to code for primary procedure. This is an add-on code and we should always assign separate for the primary code. And 22857 and 27280 have been revised. So that says 22857 says total disc arthroplasty, anterior approach including discectomy to prepare interspace other than for decompression, that is single interspace lumbar. And 27280 says arthrodesis of sacroiliac joint open includes obtaining bone graft, including instrumentalization when it performed. So these two codes have a minor change in the description. That's all in the musculoskeletal system. Next will be respiratory system. So in this respiratory system, there is only one new code added, that is 30469, that describes repairing the nasal wall collapse using temperature controlled remodeling. So this 30469 is a new code under respiratory system. It says, the description says, repair of nasal wall collapse with low energy, temperature controlled, subcutaneous or submucosal remodeling. So you should remember that this is a new add-on code under Respiratory System 2023 CPTs. Next will be Cardiovascular System. So we'll see what are the changes under this section. So there are 7 new codes and 1 revised code, and we'll see what are the new codes. 33900, which says percutaneous pulmonary artery revascularization by stent placement, initial normal native connection which is unilateral. 33901 says percutaneous pulmonary artery revascularization by stent placement, initial normal native connection which is bilateral. 33900 will be unilateral, 901 will be bilateral. Coming to 33902, percutaneous pulmonary artery revascularization by stent placement, initial abnormal connections unilateral, and 33903 will be abnormal connection which is bilateral. So we have to remember 33902 will be abnormal connections unilateral, 33903 will be abnormal connections bilateral. And there is an add-on code, that is 33904, which says percutaneous pulmonary artery revascularization by stent placement, each additional vessel or separate lesions. And then 36836, percutaneous arteriovenous fistula creations, and 36837, that is, it is for upper extremity, and peripheral artery, peripheral vein including fistula and maturation procedure. And so we'll see revised code, that is 35883, which says femoral anastomosis of synthetic arterial bypass graft in groin, open with non-autogenous patch graft, example blister and pericardium. So this is all about 2023 surgery CPT changes. Today I have discussed only integumentary and musculoskeletal, respiratory and cardio, and I am going to upload other part soon. Every changes and revised detailed code I am going to upload part by part, so please watch it. And thank you so much for watching. Please subscribe my channel Medical Coding Club, and this channel is all about CPC and the brief knowledge about medical coding. Please subscribe and support. Thank you.